Yo, yo, yo. Hey guys, welcome back to another awesome edition of the Best Practices Show podcast. It's the beginning of another week. Happy Monday, everybody. And every Monday we do something called Metric Mondays. It's a short podcast with some data that you can use right away to improve your practice and your life. And I call this one the layup. It's so easy. And it'll make a huge impact on your patients and the practice. It's called Fluoride Percentage. And I have my amazing co-host, Miranda Beeson, on to share what it is, how it impacts the practice, and how to improve it right away. So please listen up. I hope you guys enjoy this, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. And we're so excited you're here because it's the beginning of another week and it is Monday. And you know what Mondays are all about? They're about what we call Metric Mondays. I just want to say this. Thank you guys for showing up. We look at the metrics periodically, not all the time, but periodic. People love the Metric Mondays. So I want to say thank you to you if you're listening because we had an idea to start Monday off with a little bite-sized piece of information on metrics that you guys could use on your way to work or whatever. And so thank you for listening. So it's cool. And I have my co-host, good friend, dear member of our team. She's an amazing coach and part of our leadership team, director of education. Gosh, I feel like I should just take 5 minutes to list all of your salutations and credits. Her name is Miranda Beeson. Miranda, thanks for being back. Happy Monday.
Hi, Kirk. Thanks for having me back. I love doing Metric Monday. I love opening people's eyes to all of the little metrics that make their practice tick so they feel confident and they can understand what they're talking about in the office.
Do you like Metric Mondays because they're shorter and I'm short-winded on these or just because they're just great content?
You know why I love Metric Monday? Because I talk a lot about communication and culture and I love that stuff. It's one of my favorite things, but I actually really, really also love the data. And I remember being in private practice and I had so many metrics that I tracked on a regular basis, and you understand and know so much about the practice when you're looking at the numbers. So I get excited when somebody learns a new metric that they gain confidence in and feel like they can understand their practice a little better. So I love doing this because it's using like the other side of my brain, I think. Yeah,
well, I love it too because I'm a CE junkie, and every single time we do some of these or do one of these, I learn so much. And you're going to see, I always feel like the old guy in the room when I'm saying this, but I'll just give you my perspective. 31 years of doing this, the metrics have always been important on some level, but now we have so much visibility on really powerful information. And today we're going to be talking about one that more recently on the scene, I would say in the last 5 to 10 years, we've been paying very close attention to it, and it's a huge difference maker, and it's called fluoride percentage. Give us a little perspective on this, Miranda.
Sure. Well, this is the last metric that ties up the last few weeks. We've talked a lot about some hygiene metrics recently. And I think this is a really important one for the practice to be aware of because hygienists aren't the only ones who apply fluoride in the practice, but certainly it's probably most engaged within the hygiene community. So when we're looking at fluoride percentage, it's pretty simple, really, in terms of what it's measuring. It's measuring the percentage of patients who receive a fluoride treatment compared to the total number of patients seen for visits in that given period. So whether you're coding out a topical rinse, more likely than not these days, people are coding out a preventative varnish as their fluoride treatment in office. And what percent of patients that we're seeing for hygiene visits had fluoride treatment provided during that visit? And so when we're looking at this metric, we're trying to see how well we are implementing our prevention strategies in the practice. What I will share is commonly what we see in private practice is that this number is relatively low.
Yeah.
And it corresponds pretty directly with patient count that has insurance coverage on fluoride.
Yeah.
It's a lot easier to recommend fluoride on a patient who you know isn't going to have to pay for it than having conversations around the value of this preventative therapy.
Yeah. And can you go a little bit deeper on that? Because this is the thing that surprises me the most. You know, everyone says, oh, all my patients get it. Of course. Why wouldn't we? And then when we look at the numbers, we're astounded by how low they are. Give us a little bit deeper psychology on that.
I mean, I see numbers that are generally under 10, 12% when it comes to fluoride percentage. And when we look at, I'll talk to you a little bit about how it shows up low and high, and then we'll dig in a little deeper into things you can do or that mindset around why it might show up that way. Those lower percentages, which are really common, are likely missed opportunities, not only for production, because yes, fluoride is a production booster in the practice, but it's a missed opportunity to highlight the importance of prevention with our patients. When we look at fluoride varnish, we're looking at a preventative measure that is easily applied. It's actually minimally it's very cost effective. It's a minimal cost investment to the patient when it comes to the comparison to dentistry long term. The challenge becomes it's often brought up in our world, in the news and in pop culture at different times. It ebbs and flows in terms of the reports or the things that pop out on the news, and then your patients come in and I always think it's a great thing when it's on the news, even if it is negative, because now your patient's wanting to talk about it.
Right.
And you have this information that they don't have about topical versus systemic fluoride and how those things are different. So when we look at that low percentage, again, I like to say, you know, my patients, when I was a hygienist, 75% or more had fluoride varnish. And I'll explain to you a little bit about how your team can think through what's appropriate in your practice based on your philosophy. But if you're at 10 or 12%, it just tells me that the majority of patients aren't receiving this opportunity. And the worst part would be if we're at that percentage because we're not even offering it versus they're declining it. More often than not, it's not being offered if we see it's not a covered benefit. Now, if you have a higher fluoride percentage in your practice, that's going to reflect on stronger preventative care standards in your practice, better patient protection against decay and sensitivity, and minimizing the extent of the dental disease that they'll have in the future. It really drives long-term health for your patients, and it also does provide a steady revenue to your practice. If you think about a practice, and let's just pick one day, one hygienist, and there's 8 patients seen in that day, and say your practice charges $50, which is pretty common for a preventative fluoride application. If one of those 8 patients has fluoride, that's a 12% fluoride percentage for that day, and it's about $50 a day for the practice. Now, if 5 of those 8 patients have fluoride provided, you're at a 62% fluoride percentage, and now you're at $250 for the day. And if you work an average of 16 days a month, that's $3,200 in production that was added, and that's over $38,000 annually added to your production and correlating with an improved prevention strategy and hopefully longer term positive health outcomes for your patients. Yeah. So I think the biggest factor is mindset and getting really comfortable in understanding and aligning around why we recommend it, what purpose does it serve, how do we have these conversations, and how do we build value so that if it is $50 and it is out of pocket, we're totally comfortable having that conversation and we believe that the value is there behind it. And I'll say one more thing, and then I'd love for you to jump in. There's a thing called fee capping. We could probably do a whole podcast on it, but fee capping legislation is real in, I think, 47 of the 50 states or something to that effect now. And if you don't have a self-funded insurance plan, if a patient doesn't have a self-funded insurance plan, meaning government or a really large organization or something like that, usually it's the ones that have waiting periods, and their card will say that. Then, or excuse me, they don't have waiting periods. Then you can charge full fee if it's a non-covered service. And so in your practice, if a patient has fluoride is not covered, not like they've hit their frequency or they've hit their maximum. It's just not a covered service for the patient. You don't even have to charge the insurance contracted rate as long as it's not a self-funded plan. So there's a lot of revenue potential for the practice in fluoride applications, and more importantly, or equally importantly, is the corresponding health impact it has for your patients.
Yeah, I love how you said that and you use the word mindset. And so if you're listening to the podcast, like, this is how important this is. Number one, as a provider, you just have to decide, how do you really want to take care of your patients? Leave all the elements out, money, blah, blah, blah. How would I best care for my patients? Number two, this is a benefit to the patient. Like, I believe, that's number two, is like, okay, I'm going to decide how to care for people. Number two, it truly is in my patient's best interest that they get offered this. They can always decline, but I think we should. Number three, we have to value it as a team together. So that's usually the biggest thing, is people always think, well, I think everyone would agree with 1 and 2. But now we get into number 3 and we're like, well, they can't afford it. I don't know. She just told me she didn't have any money. They're an insurance patient. And now you get all in your head about somebody not willing to pay for it. And that is a hard position to be in. You have to believe that people want to pay for what you do. And then lastly, number 4, it's the benefit to the practice. Once you do 1, 2, 3, and 4, now it's like the triple win. Everyone's winning, right?
You're exactly correct. And I love prioritizing it in that way, because I like to say that anytime a metric's improving, it means our patient's health is improving. And that's
right.
The most important thing that we can do, is make a positive impact on our patient's health. And if we look at hygiene, we say we are prevention strategists. That's what we're here to do, is to help you prevent disease. And hopefully we'll stay in that space. And if we ever aren't, we can help you treat and manage disease that occurs. And so if our primary job is to prevent disease for our patients and help them in that capacity, then we have to look at all of the opportunities and options we have in our toolbox, and then allow the patient to decide if this is something that they want to utilize or not, versus being biased around it. And I will say that most practices, kids always get fluoride. And then as soon as we hit 18 and it's not a covered benefit anymore, a lot of times we just don't even offer it. And I actually used to laugh with patients, and they'd say, well, is my insurance going to cover this? And I'd say, it's so crazy. Your insurance plan thinks that once you turn 18, you don't get cavities anymore. And they're like, ha, 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 whatever. But you know who you can play with and who you can't when you're having those conversations. But I think there's a couple of really simple, easy things that practices can do to improve this metric, and in turn, like we just said, improve your patient's health. And the very first thing is aligning, just like you said, how do we get our mindset aligned? And I think the easiest way to do that is to create a caries risk assessment process in your practice. It doesn't have to be a robust, complex Canberra where we're taking plaque scores and things we did back in school. It can be a simplified version where you all agree that based on our philosophy of care, we believe in prevention. Okay, when we see these signs, what do we do? If we see, maybe we're going to use disclosing, maybe we're not. We're going to ask them if we see a lot of cavities or we see some decalcification. We might ask them about dietary habits. Maybe that's part of our intake paperwork. What are you going to build in your practice into your caries risk assessment process? And then have a simple cheat sheet. If somebody is low risk, perhaps we don't recommend in-house preventative varnish. We just talk to them about the impact that it could have, or make sure you're using a toothpaste with fluoride in it at home, or using xylitol products at home, something to that nature. If they're moderate or high risk, we probably are recommending a varnish in-house, and we're more than likely recommending a product or products at home to help support in between their visits as well. And you just have to align on as a team on what products you're using and when they're recommended. And once you've developed this risk assessment process together, you work as a team, use your team meetings to make sure that everyone is aligned and calibrated on when we offer what. And then we start tracking it using this metric of fluoride percentage so that we can see, hey, we created this system, but you know what? Our fluoride percentage is exactly the same. That seems crazy because I know I diagnosed 3 patients yesterday with fillings. So let's look and see if those people got recommended fluoride. And so now we can start looking at, are we actually fulfilling this new system that we recommended or created together? And then the other piece is around language. And I love the phrase, so that. Always leading with the why is a great phrase. So you and your team could develop a so that statement or even a couple of so that statements that help support the recommendation. Because I'll tell you, it's happened to me where I finish a hygiene appointment and the hygienist looks at me and says, "So fluoride?" And I think to myself, is this how you recommend fluoride? Like, how would I know other than probably to just say no? And so if instead we lead in with, so that we can protect the restorations that you already have and help prevent you from having new decay in the future. The last step today is your preventative varnish. We'll finish with that before we reserve your next appointment. Or perhaps your patient has a lot of root surfaces exposed, so that we can protect those root surfaces. You remember we were looking in the mirror together, Mrs. Jones, where you have recession. They were also sensitive while I was doing your hygiene visit today. We can protect those with a preventative varnish before you head out. So that'll be our last step. And then we'll make sure we get you reserved for your next visit in 3 months. Now, the patient might ask you, is my insurance going to cover that? And again, depending on your patient, you can tell them, funny thing is, your policy thinks you don't get cavities once you turn 18. Or you can take a moment to explain that, I'm actually not sure about your particular policy because as your hygienist, my responsibility is to making health recommendations that are customized to you. But we can definitely make sure that our administrative team can go over that with you. And then usually what I would do is know how much it cost. And I'd say, worst case scenario, Mrs. Jones, it would be $50. But that's a lot cheaper than a crown. And then Mrs. Jones would say, you're not wrong, Miranda. And then there's one other phrase that I love, which is just if there were a way. So if you did have new decay diagnosed today in the chair during the exam, a great way to recommend fluoride and have a positive conversation around it is just if there were a way to prevent future fillings from being needed or crowns from being replaced, would you be interested in learning about that? And now you've opened the door to, hey, I have this product. We can do it every time you come in. And it gives them the opportunity to say yes or no.
That was so well said. If you're listening to this podcast, I hope you were really listening because that's where you get to see all of this come together. These, number one, like if you're driving to work, I want you to do this. Pull this number, just find out what it is. And then number two, share this podcast with your entire team and just say, listen, we're going to have a conversation about this. And then number three, what gets measured gets improved, but what gets measured and on a regular basis and reported on exponentially improves. It involves a conversation. Miranda gave us all of the obstacles and how to get around them. This is like a layup, you guys. This is truly one of those things. We're practice coaches. This is what we do. And a lot of times, some of the best teams we've ever seen are not good at this, and this is exactly how we help them. So I want this to help you too. And if you need more resources, we have tons of them back in the Best Practices Association. Miranda, that was so good. Thank you so much.
Thanks, Kirk. And as we wrap up, because we're going to keep it bite-sized, I just want to say great point of bringing your whole team into this because guess what? Your administrative team, they're going to get the objection once the price is in front of the patient. So them being able to know and understand why we do this and how to conversate around it is really important too.
So well said. There you have it. 16 minutes, 55 seconds. We did it. Monday morning. Bam. Fluoride percentage. So that's another Metric Monday for you. So hope you enjoyed that. Keep showing up on Mondays. We're going to keep bringing it. Keep you guys focused, keep you positive, and give you something to do at the beginning of the week to help you create a better practice and a better life. And again, if you need more resources, that's what we do. We're building an entire huge, unbelievable platform back here called the Best Practices Association. Make sure you check it out. You can get the app and start the journey for free. There's nothing easier than that. And if you need more help, we're practice coaches. That's what we do. We can help you get to the place you want to get to. So until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. I hope you guys enjoy your Monday.